Hi, I'm Doc July, and this is how I remember TTP HUS findings and treatment. TTP, or thrombotic thrombocytopenic purpura, and HUS, hemolytic uremic syndrome, are rare multisystemic disorders that share a common underlying pathological process termed thrombotic microangiopathy, characterized by endothelial cell injury, intravascular platelet fibrin thrombi, and vascular damage. HUS presents with a triad, and TTP has the same three features, plus the presence of fever and neurological symptoms, creating a pentad. This is a very simple mnemonic, but it works very well to remember that it is TTP that has a pentad. The mnemonic for the pentad for TTP is FAT-RN, fever, anemia, thrombocytopenia, renal failure, and neurologic decline. As previously mentioned, HUS presents with the triad of anemia, thrombocytopenia, and renal failure. It is easier to remember the triad as RAT for renal failure, anemia, and thrombocytopenia. It is important to note that the anemia is microangiopathic hemolytic anemia, which is characterized by the presence of red cell fragments or schistocytes on blood smears. To summarize thus far, TTP has a pentad, FAT-RN, while HUS has a triad, RAT. Another thing to remember with TTP is that patients with TTP have problem with the protease. This proteolytic enzyme is the ADAM-TS13, which normally cleaves the von Willebrand factor. If ADAM-TS13 is absent, VWF-dependent platelet accumulation continues and eventually causes microvascular thrombosis and TTP. It is believed that the ADAM-TS13 in HUS are generally normal. And the last P in the TTP mnemonic is the plasma exchange, which is the mainstay therapy. Other treatments include glucocorticoids. Although never evaluated in clinical trials, the use of glucocorticoids seems a reasonable approach but should only be used as an adjunct to plasma exchange. Additionally, other immunomodulatory therapies have been reported to be successful in refractory or relapsing TTP, including rituximab, vincristine, cyclophosphamide, and splenectomy, with rituximab having the most evidence for efficacy. Treatment of HUS is primarily supportive. In HUS associated with diarrhea, approximately 40% of children require at least some period of support with dialysis. In patients with atypical HUS, eculizumab has efficacy in resolution of HUS and improving or preserving renal function. In summary, TTP has a pentad, and patients with TTP have a problem with the protease, that is the ADAM-TS13, and the treatment is plasma exchange. In HUS, the treatment is primarily supportive. Please subscribe to my YouTube channel, Memory Aid Medicine. Thank you.